Focus. Ideate. Innovate. Enable.
Biggest startup B2B challenge in India, the IBM Smart Camp India, completed its third edition in 2016. For its third edition, the IBM Smart Camp India had been divided into 4 categories: Health Tech, Smart City, Deep Tech and FinTech. The Smart Camp for Health Tech was conducted at T-Hub, IIT Hyderabad, where innovative, game-changing startups focusing on health tech, which use IT, were invited. The event kick-started with participants presenting in front of a panel of judges, where a total of 8 contestants were shortlisted to make the final presentation. With stiff competition in the health tech category, even the stakes at IBM Smart Camp India 2016 were higher in comparison to its previous editions. The guest of honor, founder and chairman of SciEM, BVR Mohan Reddy, shared his views on the best entrepreneurial practices for startups.
The first and the foremost about a startup before it even scales up, to get into a mode of being successful, you need to have an idea. An idea which has to be distinctively different from others. The first lesson we learned as an entrepreneur is entrepreneurs travel on a path less traveled by others. So entrepreneur always thinks of doing things better than what the customer expectation is. You delight the customer, you charm the customer. How do you do that? It's just not by saying, I will charm the customer, I'll delight the customer. No, it's a lot of hard work. You got to innovatively think how you will be different. Simple idea we took. I interact with a number of startups. Occasionally I feel very disappointed about it. The numbers that you have on paper, numbers they speak about, they're not true. That's not very good. Never lose your values. You'll make money. You'll make money some point of time. You'll become successful for sure, but you'll go to sleep very well if you think, I didn't lose my values today. There are a number of unicorns in this country today. I believe today, the last count that we know of, we have 137 unicorns around the world. In India, there are 9 of them. And I feel extremely confident that some more are there in this country, and a few of them are in front of me.
After the grilling session in the morning, the top 8 contestants were to make their final presentations to an esteemed jury comprising VCs, angel investors, enterprise CIOs, IBM executives, and key influencers in the healthcare domain. The jury would rate the contestants on various parameters like innovative solutions, features and demos, ability to scale, team behind the product, and the market size they are addressing with their solution, and give their votes to decide the top 3 pitches from the shortlisted contestants. This process then revealed the top 3 winners in the category.
We are the first talent sourcing and development platform for the healthcare industry in India. And let me take you directly to the work we are doing. We're working with the largest eye care chain in the country, which is growing at opening 2 centers every month. And having a load of more than 400,000 OPD patients annually. Addressing 3 important parameters here. One is quality, the other is shortage, and the third is underutilization. And the mission therefore is to kind of create a platform which allows healthcare providers to search for talent, and then to actually train the talent and increase their efficiencies and cost savings. Both these platforms comprises of various learning modules, which are gamified learning modules, e-learning modules. On the screen here you see our games which we have launched for nurses. One is in infection control, the other is for dental assistants, which tests the most important aspect of how a dental assistant learns to recognize, to give the right instrument to the dentist. And on top of it, if the content is in regional language, which is as difficult a language which could be Ladakhi, that is what Bodhi does. Over the next 4 years, while technology remains the key backbone of what we are like, the way we are scaling up, we plan to really be McDonald's of learning and create simulation centers and simulation labs.
We are a group of neuro and technology experts who are working on a very different yet niche and important segment within healthcare, which is human behavior analysis. So here I present Attention, that's the world's most advanced attention measurement system, which has got best-in-class equipment. It's simple and non-invasive. It's got powerful analytics based on big data and several layered machine learning algorithms. It's scientific and research-based completely. It's both for treatment as well as prognosis, and it's using FDA-approved methods. We've got an EEG headband which is capable of commercial-grade accuracy. It's got 14 channels with 256 Hz per second. Medical-grade wristband which records not only your heart rate variability but also your skin conductance response. Sophisticated technology. And then we have an iPad which has got an inbuilt facial recognition algorithms which senses your emotions and your head movement and so forth. What these three devices give us is data in 6 modalities. EEG, again sophisticated data for anything to do with neurosciences. We are targeting objective prediction of ADHD as a key market right now, and treatment market, which is special schools and even doctors and clinicians.
Daily Rounds is a feed of cases shared by doctors across the globe, and once the case is shared, there is a rich discussion which will happen, and we have something called a verified correct diagnosis, and each case becomes a learning module. So think like a Facebook or Instagram but with cases, and we have all other user generated network features like follow, follower, upvote, comment, thanks, discuss, etc. So we thought, we have this wonderful highly engaged community of doctors, why can't we put all this to a mobile app? And that's when we launched the point of care reference almost 3 months back. Now we host India's largest and most comprehensive drug database, brand information, guidelines, journals and basic CDSS, clinical decision support system inside the Daily Rounds app. We have 250,000 doctors as of now. 500 doctors join our app platform every single day. Daily Rounds is the highest rated app in the medical category, that's globally. Now if you look at healthcare, it has 3 pillars. You have the industry, healthcare, medical, pharma, medical devices, and you have the consumers and doctors as the facilitators. So what we provide on a high level is access to doctors, to this industry, to provide a very transparent service, because a lot of things which are done currently is not transparent. It could be under the table or over the table, but what we enable the industry is that to provide and reach out to a doctor in a very transparent manner. And our final vision is very simple. So doctors take these micro decisions, around 20 to 30 micro decisions every single day, which affects everyone's health. So we positively influence these treatment decisions, and thereby we influence and bring out positive healthcare outcomes.
The IBM Smart Camp is one of the unique B2B platforms, right, where we've been running it for a few years now, and this year is the first time we are doing it with an industry flavor.
On the other side of the break, we look at how the remaining participants fared in their presentations. Down, 5 more to go. The pressure to deliver a winning presentation was visible to the gathering. Now only time will tell who will go home with the ultimate laurel.
Unlike my other participants, they presented a lot on research on medical devices, some behavioral patterns and all. I will simply take you through a very, very profound and a large problem existing in healthcare space, that is medical supplies, regularizing medical supplies through a continuum channel of tech-enabled platform. So if we look at the problems today, typically medical institutions suffer with problem of ambiguity, awareness, accessibility and availability of medical devices, disposables, consumable and equipment. Typically this problem leads to cost push, and that makes our medical treatment unaffordable in certain cases in tier 2-3 cities, from the point that it pushes the cost to such a level that healthcare delivery cost increases to a greater extent. We cover the complete 360-degree approach to medical supplies, starting with sourcing to vendor value management, catalog, auto-generated quotations, easy finance and EMI options, especially for smaller medical institutions, purchase invoice management, savings, spend analysis, and profitability. So we cover everything related to making a healthcare institution look better and profitable. This is how our revenues look like. We are fairly new startup, started a year back. Last year we closed at about 22 million INR. This year we are looking at about 120 million, and going forward to about next 2 years 500 million. If you look at in just 1 year, we are already transacting with about 1400 institutions. We already have 3,500 institutions come and sign up with us. They are regularly accessing our website. We have large number of merchants on board, manufacturers, many suppliers in between, and very large number of SKUs we are dealing with.
Oxygen's mission is to build an advanced child healthcare solution. Their product leverages the Internet of Things, cloud and big data technology, enhancing the doctor-patient engagement model by enabling continuous and personalized child health monitoring.
I will be presenting you today about the complete child healthcare solution. This is the third product wherein I am involved. So the first product I have sold to Philips. Second product I did for Sun Pharma, and this was a personal experience. As a parent, I had twins which were 28 weekers. We lost a baby, and me and Ramneet, who's my wife, we were heading Oxygen, a very profitable company from day one. I realized that the biggest problem, we saw various use cases. The biggest problem in a neonatal intensive care unit is the variety of devices we have. We have monitors, we have ventilators, warmers, all coming from different companies, and no disrespect to anyone, but every company has a right to have its proprietary framework and keeping the data with themselves. But that makes life of a doctor very difficult, because he is getting data coming from the monitors, warmers, he has nursing charts, he has his own doctor rounds, and these babies which get admitted into a neonatal setup are like 400 grams, 600 grams, and they get discharged when they are 2 kgs. So they change the weight by almost 400%. So in 70 days, a patient whose weight is changing every day, his medication, his feeds, everything has to change. So you need to have a very smart platform which is capturing data, both the real-time feeds, both the clinical care data. So an NICU solution is basically, you log in and you have all the beds which a baby, your facility has. And when you look at a bed, you get all the devices, be it the monitor, be it the CPAP, be it your blood gas machine. You get all this data, which is your device data. Then you have the clinical care data, the nursing charts in terms of the feeds going in terms of urine coming out, the lipids, ammonia, intravenous. So all those calculations along with the doctor notes in terms of what the problems are with this specific baby on a given date, combined with the test results which are coming to this baby from a lab information system, combined together to create a single point of view, a Watson view of analytics in terms of what this baby is doing. Traction right now, we are in 20 hospitals present. The ICHR, the piece which takes care of the e-prescription, vaccination, I couldn't show the live demo. So that is being live in all these hospitals. The INICU portion has been done in Fortis and Kalavati.
At PharmaRack, what we are trying to go to platform for all participants in the pharma supply chain. The distribution business is essentially a very, very human capital business. So that's where our technology immediately plays a role. Reducing the workload on the human capital and making our distributors more scalable. So help them increase their top line as well as reducing costs. What we have been able to do with the transactions that we have generated is we could help companies with a micro level information. We can go drill down at a street level telling where that product is lying. What we provide, we can provide to the companies is a platform where the companies can directly reach out to retailers. Currently we have 10,000 plus retailers are being serviced through PharmaRack platform. So those retailers can, can interact, can know about a new product that your company has launched. Our business model is a subscription based model. We just charge our distributors currently and the companies for the This is our traction. Currently, we are at a run rate of 2 million orders a year and 750 crores worth of transaction. We have 10,000 plus retailers and close to 500 distributors. We are present in approximately 35 locations. Our primary presence is in Maharashtra and in Gujarat.
THP stands for Technology, Healthcare, Big Data Analytics. This is the product framework that we use to run the analytics. There are existing provider systems, and it varies from a lab or a hospital. It's an EMR, a lab information system, a hospital information system. Bigger ones also have CRMs, etc. The first thing we do is we actually bring everything together in a new data warehouse, which is structured in a way that it can conduct seamless analytics. And that's actually one of our biggest value adds, of bringing every single piece of data at one place so that we can run seamless analytics. So we're basically using a lot of the data streams, putting it together, and then giving value across the board to the management team, to the doctors, as well as to the patients. There are 4 areas we are focusing on. We're rolling out in pathology and diagnostic labs, nephrology, kidney transplant, and liver transplant, where our products are ready. We're doing pilots on cancer and OB-GYN. We have about 15 plus clients today, distributed between labs, nephrology transplant, liver transplant, and cancer, and 1 OB-GYN pilot. We're working with the likes of Fortis Hospitals, Apollo Hospitals, working with the likes of Suburban Diagnostics, done a pilot with ThyroCare. So we're working with some of the leading brands in the country.
3R is a tool company for early detection of breast cancer. And why is that? 70% of breast cancer deaths today happen in the developing world context, and India is no different, right? India loses more women to breast cancer than any other country in the world. And why is that? 2/3 of cases diagnosed are diagnosed at stage 3 or stage 4. And when we look at this entire spectrum, the reason that happens is because we have no access to screening modalities that are adaptable to our context. It's a very, very complex puzzle that we have to look at. And so we looked at this spec sheet and we said, what do we have to do? And that's our solution, right? That's the iBreastExam device, and that's what it is, right? It fits in the palm of my hand. It's a portable, it's the world's first US FDA cleared, ultra portable, battery powered, wireless, Bluetooth enabled, tablet backed, cloud backed, everything. It's a painless and radiation free, right? So it's not a mammogram. Please do not equate this to a mammogram. Mammograms have x-rays. This is completely x-ray free. It's radiation free. It can be operated by the infrastructure we have today in our country, right? Which is what? The primary line of defense for that 90% of the population is the health worker, right? Impact for health in India can only be delivered by the frontline health workers, which are the ASHA workers and the ANMs. And this can be done. This can be used with your healthcare worker. So far we've had 20,000 women who've received a breast health exam through our device in India, and we already have commitments to screen 4 lakh women over the next year to 2 years.
Finally, it was time to draw the curtains up on the winners. The second runner-up for the evening is co-founder and CEO of Daily Rounds, Dr. Deepu Seven. The first runner-up was Akshat Shah, Head Strategy and Business, UE Life Sciences India, and the winner of the Smart Camp India Health Tech is founder of Oxygen Technologies, Harpreet Singh. The winners of IBM Smart Camp India 2016 will be given access to IBM Cloud credits and can leverage the best of IBM technologies around cognitive, cloud, analytics, mobility, IoT, and infrastructure as a service.
That we are building a genuine problem, solving a genuine problem by doctors. So these are the problems which we faced. Our product is genuine and the solution is something which really needs. So I think that has been the plus point which led us to be the winner.
It's fantastic to win this accolade. We are just chasing our impact mission, and our impact is to empower providers to reach out to women who otherwise are not being reached out to provide a screening solution so that you can catch their breast cancers early and potentially bring down the disease burden and as a result the ensuing mortality rate.
We are trying to solve a basic need of an Indian child. He needs to have a good quality of health when he is in a neonatal ICU. I started this journey as a parent, and to see the industry supporting in that journey, it's a huge value.